Who should get an HPV test and when? Have you ever wondered who should get an HPV test and when? Human papillomavirus testing plays a crucial role in cervical cancer screening. It helps detect high-risk HPV types that can lead to cervical and other reproductive cancers. The guidelines for HPV testing are quite specific. For women aged 30 to 65 years, HPV testing is recommended every 5 years. This can be done as a primary screening method or in combination with a pap smear, also known as coat testing, every 5 years. Alternatively, women can opt for a pap smear alone every 3 years. It is important to note that HPV testing is not routinely recommended for women under 30. This is because HPV infections are common in younger women and often resolve on their own without treatment. When it comes to women aged 21 to 29 years, routine HPV testing is not advised. Instead, cervical cancer screening is conducted using a pap smear every 3 years. HPV testing in this age group is only performed if the pap smear results indicate abnormalities. Women over 65 years may stop screening if they have had adequate prior screening with normal results and are not considered high risk for cervical cancer. High-risk factors include a history of cervical precancer or cancer, or conditions that weaken the immune system. Higher-risk individuals, such as women living with HIV, those with a history of cervical precancer, or those who have been exposed to diethylstilbestrol, may need more frequent HPV testing and screening. For those who have undergone treatment for cervical dysplasia or cervical precancer, HPV testing is often part of their follow-up care to monitor for any recurrence of issues. It is also essential to understand that HPV vaccination does not change the recommendations for screening. Vaccines do not protect against all cancer-causing HPV types, so HPV testing remains necessary. HPV testing is vital because persistent infection with high-risk HPV types is the leading cause of cervical cancer. Early detection can lead to timely intervention, preventing the progression to cancer. Emerging technologies, like at-home HPV testing kits, are being developed to improve access to screening, especially for underserved populations. These kits allow individuals to collect samples at home and can detect a wide range of high-risk HPV types. In summary, HPV testing is primarily recommended for women aged 30 to 65 as part of cervical cancer screening, typically every 5 years. Younger women are screened with pap smears, and those at higher risk may need more frequent testing. It is always best to discuss personalized screening schedules with healthcare providers, taking into account individual risk factors and medical history.